Let's bring in MS Now reporter Will McDuffie, who is monitoring this from Capitol Hill. Will, what more are we learning about Dr. Means and her qualifications for this role?
Well, you mentioned those qualifications. Sure to be a line of questioning, Anna, from senators today. She got a medical degree from Stanford, but then dropped out of residency before she completed her program. And she mentioned the over-medicalization, her disillusionment with the way that medicine is traditionally practiced in the United States. And that has appealed her to the MAHA movement, and she's sort of been plucked from that movement here as Surgeon General nominee. You know, her belief in wholeness in health treatment, you know, fewer treatments, fewer prescriptions, more focus on a healthy lifestyle. And that's exactly what aligns her with RFK Jr. and other figures in the MAHA movement. Of course, vaccines always a hot topic when it comes to health and human services right now. She was asked about that from Senator Bill Cassidy. Let's take a listen.
I have not read that article or seen.
Would you
FDA.
encourage mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die and this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's bodies.
You're the nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body. First, I would have a private and direct
that questioning from Senator Bill Cassidy, the Republican head of the Health Committee. He's a physician himself. He's a key proponent of vaccinations, but you can see exactly, Anna, the kind of delicate language that we often hear from health leaders in this administration about vaccines. Anna.
Will McDuffie, thank you. Keep us posted. And joining us now is former Chief Medical Officer at the CDC, Dr. Deborah Howry, who left the agency last summer, saying she wouldn't be a rubber stamp to the Kennedy agenda. Doctor, it's good to have you here as we continue to monitor this hearing. I just want to underscore that Dr. Means, who you see there, the woman who could become the nation's top doctor, dropped out of her residency program in 2018. She is not board certified. She doesn't hold an active medical license. Now, that being said, the Surgeon General is supposed to be a spokesperson, right? Their role isn't necessarily to be an active practitioner. Does it matter that she doesn't have an active medical license? Why are you concerned about her background?
I agree with you, but I still think
I think it does matter that she doesn't have an active medical license. When, Surgeon General Jerome Adams, who I worked closely with in the first Trump administration, raised this as a flag. To lead the U.S. public health services, you're supposed to have a valid medical license. So that in itself concerns me that she's not able to run this large service. And if you haven't practiced clinically, how are you supposed to be the nation's doctor if you haven't taken care of patients?
The Atlantic points out that in 2024, Means said at a Senate roundtable on chronic disease that what we are dealing with here is so much more than a physical health crisis. This is a spiritual crisis. Part of her solution to both these crises is to reject experts and institutions in favor of something far more alluring: intuition. What do you make of this approach from a potential Surgeon General?
So I do think, there is an art to medicine, and intuition can be important, but so is data and science. And I think following, the recommendations of groups like the American Academy of Pediatricians is really important. And I would also just say it's important for self-reflection. When I look at some of the conflicts of interest she had, including family investments in tobacco, that concerns me from a wellness perspective.
What key questions do you think she should have to answer?
So I thought Senator Cassidy was going down the line, but I would have pushed a bit further. As a spokesperson for the nation, sometimes you have to personalize things. I would have asked her, as a new mom, have you vaccinated your baby for polio and for pertussis and whooping cough? Those are important things. If she's not willing to do that and speak about it, why would others then, follow suit and get their children vaccinated? She really towed the line on that. I would also want to know, how does she plan to work closely with the CDC during an outbreak? She's had no preparedness experience. And should there be another health threat, whether from a derailed train or an infectious disease threat or bird flu, what is her experience to be able to protect the public?
medical education.
And the Washington Post found that Means made over $500,000 from partnerships with companies described as selling diagnostic testing, herbal remedies, and wellness products, as well as teas, supplements, and elixirs from 2024 and into the summer of 2025. This is according to her financial disclosures. Means signed an ethics agreement stating she would stop putting up monetized social media posts and promoting her wellness book. But, Doctor, do you see possible conflicts of interest?
Step one, I
do think there's still conflicts of interest, and
Dr. Marty Makary,
who knows what will happen post Surgeon General for her if she would continue to market this. She's certainly during even her nomination period and being considered certainly saw growth from this market. I think there's an inherent conflict of interest, and she needs to pay just as much attention to proven medical treatments. I do think holistic medicine can have an important role, but you also have to look at things that are proven, like vaccines.
Switching gears slightly, there's a new man at the helm of the CDC, your former agency. The current NIH director, Jay Bhattacharya, is now going to wear two hats, also becoming the acting director of the CDC. You were a senior leader there for over a decade. What's your reaction to this move?
So even not talking about, his skills in itself, they're in two different cities, two very different missions, one on biomedical research, one on public health on the ground. And there's conflicts of interest. Should there be budget cuts? How's he going to defend CDC's over NIH? Will he look at moving programs from CDC to NIH? And if there's a crisis, how's he going to really work between both agencies? You need someone on the ground at CDC. CDC has been leaderless and without that strategic direction for almost this entire year. Our nation is at risk, and we need somebody that is there.
We're going to stay on top of all things happening at HHS. It's about our families and our nation's health. Dr. Deborah Howry, thank you for being a resource for us, as always. Appreciate it.